Thank you so much for joining. We have our speaker, Isha Garg, with us. Isha, would you mind sharing the PPT, please?
Yeah, sure. Hello, everybody. Very good evening.
Okay. So, a very good evening and welcome to the event of Salesforce Marketers Group out of Ajmer, India. Today, we will be talking about Health Cloud. So, the topic of today is let's explore Health Cloud with Isha Garg and Pardot Ajmer. Uh, we will be running a contest over Twitter. Whosoever will be winning the contest will be getting a certification voucher. Don't spam the Twitter with PPT screenshots. We will be appreciating if you can make a video or make notes of whatever you're going to learn in this session. Uh, Isha is okay. So I'll be starting with my quick introduction and then we can move forward with Isha's introduction and the topic. Uh, I have posted all the hashtags and everything in the chat. You can just quickly go through it and start posting. So I'll start with my introduction. My name is Payal Longani. I am Forex Salesforce certified, working at UST as a Salesforce developer. I am a proud marketing champion of class 2021, and I am happy to share my learnings and help other trailblazers in the community. You can reach out to me over Twitter and LinkedIn with the same name. So this was a little bit about me. Over to you, Isha.
Hello, everybody. Good evening. Myself, Isha Garg. I am a marketing champion, uh, proud Golden Hoodie winner, the third winner in India for Golden Hoodie. I lead Blazer certification camping with my friend Arpit Vijayvargya to blaze admin trails for a couple of trailblazers. You can find us at blazercertification.com and a couple of campaigns that you can always catch me over Twitter. So today I am here to share a couple of my learnings of Health Cloud. So before we proceed, I'll be keeping an eye check over the chat window as well, or we have an open Q&A towards the end as well. How many are Health Cloud experts over here? Or just a small KYC, that's okay. If you say one, that's okay. If you say two or three. So one means nothing. I'm just new to Health Cloud. Two means I'm an intermediate, maybe like me, because again, I'm not an expert. Uh, and three means we are way expert and certified, or just not necessarily certified, but yes, we are experts in Health Cloud. So, quick reply in the chat, and even the leader of the group, Payal, would be catching the active trailblazer from the chat as well as Twitter. But please do not spam the PPT, because this PPT would be readily available on the RSVP page as well, so as to stand a chance to win a certification voucher. Okay, so I got a couple of responses, and I think we are good for the day, because we are learning very basic of Health Cloud today. Just exploring what is it. I don't know anything about it. I'm not saying about me. I'm just assuming, hopping in your assuming you don't know anything about Health Cloud, and uh, everybody's here to explore, right? So Health Cloud, by the name, you see that it's a patient or something related to patient centric healthcare. So, yes, it's correct. It's the new reality of the patient centered healthcare. Okay. So, it basically revolves around providers, payers, and at the same time, patient expectations for information, interaction, and access have risen dramatically. So we are going to see a couple of pointers or things. What is all about Health Cloud? What are the key advantages of Health Cloud? What are the basic objects, maybe at the scratch that you want to see? What are the basic objects that we use in Health Cloud? So, before starting, there's 78% of patients are unsatisfied with the US healthcare system, and that's not me saying this. It's survey given Deloitte survey of US health 2012. So, I hope my screen is visible and my voice is loud and clear. Just let me know in the chat. I am switching between the chat and my slides simultaneously so as to understand if there are any questions. Okay. So, to succeed, the industry needs to evolve from a focus on medical records management to a focus on patient relationships. This is the clear path that you can see on the screen to improve patient satisfaction, high quality patient care, controlling avoidable costs, and improving outcomes. Yet, providers are nothing but hospitals today are burdened by legacy systems and are challenged to make the shift to healthcare that is one-to-one smart and connected to patients' needs. So, healthcare, Salesforce Health Cloud uses the power of the cloud, social, and mobile technologies. That's the most boom or the wanted feature in today's life to create an environment that enables everyone from admins to patients to specialists to get the information they need at any time and on any device. Curious what the platform is really capable of? So we are going to explore core advantages of the new health cloud, complete patient management and connected patient engagement, giving healthcare providers the ability to go beyond health records and build stronger relationships with patients. As I said, we are going to explore the three core advantages of Salesforce Health Cloud. So, this is number one, complete patient view. Again, I'll give you a small matrix over here given by not me, Salesforce State of the 2015, which says 63% of millennials would be interested in proactively providing their health data from wearables to their doctors so they can monitor their well being. Okay, this complete patient view that we are going to talk on the next screen provides a view of the patient, which can create rich contextual patient profiles, access collaborative care network and health timelines, integrate patient data from the EHR. EHR means electronic health record. Incorporate third party data from medical devices and wearables. With a complete view of the patient, you have easy access to the right patient information, including current conditions and medications, appointment history, and communication preferences. You might be feeling like, hey, these are a couple of heavy words, but don't worry, we have a demo towards the end. My demo is ready, my trial org is ready, so that you guys do not stuck till the only on the presentation today. You also go beyond to learn more, to do more of hands-on after the session. So, Salesforce Health Cloud works synchronously with your health systems EHR. EHR means anybody? EHR means in the chat. I just told you. Anybody, come on. I hope everybody's listening. Yes, it's electronic health record. Great, Shril. I appreciate that you are listening very nicely. To make patients' data easily referenced, actionable, and current from any device. And with medical devices and wearables integrated directly to Salesforce Health Cloud, you can even gather data from at home devices such as glucose levels, sleep patterns, and activity measures. These are the key roles. I hope you all can see on my screen. Oops, yeah. I'm not able to magnify it. Let me just check if I can. Nope, I'm not able to magnify. I hope it's visible to everybody. It's quite small. Okay, don't worry. I'll be sharing the PDF of the presentation very soon, or else you would be able to have the recording as well. So don't worry on that. This is I'll be showing you the same screen over the demo parts as well. Okay, so don't worry on that. Salesforce Health Cloud delivers a holistic and real-time view that you have. Okay, you can see this timeline, right? This is a real-time view of each patient's health, giving healthcare providers the information they need to provide care that improves outcome for patients and populations. So this is very small, but just understand the timeline when they woke up, when they what was the sugar level. So this is like I'll tell you in as well. It's not always that everything would be over the timeline. Whatever you want, you can always filter it. Whatever timeline you want, you can always filter it. At least you can see this word care plan. So there's something called as care plan in Health Cloud, which will help the patient, help the healthcare to provide the information they need to cure the patient, the exact information. Okay, like let's suppose there's a diabetic patient. So what type of care it should be having? We need to have a regular glucose check. We need to avoid couple of food items, right? So everything would be included in the care plan. Maybe exercise would be included. So everything would be included in the care plan. Next advantages, smarter patient management. Uh, Health Cloud feature today's page to provide a holistic view of your patients and the most critical tasks related to your full patient population. With the Today view, you can make care decisions efficiently by browsing the customized care plan for tasks and quickly acting on them. You can also segment and manage patient population, such as sending a message to all patients with high blood pressure to schedule regular check ins in a single, secure, and private message. So, this is all about smarter patient management. You can have pointers on the screen as well, which makes it possible for healthcare providers to prioritize tasks across all the patient needs, manage patient populations, map personal and professional caregiver networks. So, what is this caregiver networks? How do we map it and stuff? I'm going to show you on the demo part. So, don't worry, hold on tight. On the next screen, you have this collaboration and activity, which would be again in the demo part. But this is the patient, okay? This is the network left and right, external and the internal network of the patient. External maybe a psychologist, a spouse who has the caregiver role. Shauna Green is the spouse. Maybe this would be Charles Green. Yeah, this is Charles Green. So Shauna Green is the spouse and give her a role of the patient. Then the daughter of the patient. Then the PCP. PCP means primary care physician. It's Dr. John Bosworth, care coordinator, diabetes educator, psychotherapist, cardiologist. This is the whole network of the patient. Uh, So here we have the external networks, and on the right hand side we have the internal networks. With the power of Salesforce platform, you can review all internal conversations that involve your patients, making care coordination and patient handoffs easier and more efficient. You can even map personal and professional care networks, so you can assign ownership of health goals to anyone on the care team, including the patients of their families. Salesforce Health Cloud empowers you to easily manage your full patient population. This is nothing but the population. Personalize every interaction and drive better outcomes. So these were the core two advantages. We land up to the third one, which is connected patient engagement. I'll just stop for a pause for a while and look at the if there are any questions. Okay. Looks like the screen session is already started. I don't know what problem you are facing, Jen. While if you can check with him.
Yeah, definitely.
Okay. So
Yes, Isha, I believe we are good to go.
okay. Okay, so guys, don't worry on the picture part. It's quite small because they are the screenshots. But don't worry, I would be pulling them on. Okay, so don't worry on that. If you see one question, trial of Health Cloud, it is definitely there for 30 days. And don't worry, be sharing the trial org link very soon. Just after my presentation, maybe before my demo if you guys want. Okay. So, okay, here I continue with the third pointer, that is connected patient engagement. Again, a good report on it, which says 71% of millennials expect to use mobile apps to manage their healthcare, yet most healthcare systems aren't equipped to provide this option. This is a report by Salesforce State of Connected Patient Report 2015. Salesforce Health Cloud makes healthcare information. Oh, one moment. I'm missing on that slide, but I'll update it before I'll share, which says it makes healthcare information more accessible, improving workflows and care outcomes, collaborate seamless with care teams and patients, assign tasks to caregiver networks, and share secure messages to any device. With Salesforce Health Cloud Care coordinators can securely collaborate. That is what for coordinators are, and assign tasks across the caregiver network, the external network that we just saw over here. This extends across the full care system as you can work with the patients to chart progress against care plans or goals. Easily communicate with physicians, care coordinators, and family members and get answers quickly. Let's suppose cardiologists need to understand some family history. So, with the help of this population, the cardiologist or maybe psychotherapist can easily connect with the like maybe the external network, maybe the spouse, maybe the daughter, or maybe other psychologist which is connected to the patient. And by extending Salesforce Health Cloud to mobile platforms, you can send secure messages to patient mobile devices, meetings their expectation for convenient communication, encouraging deeper engagement and accountability, and developing stronger relationships and loyalty. Who doesn't want a doctor to be, available with just a small click? Okay. So here I'm just stopping my presentation and I'll be back on the slide again, or maybe just a notepad. I want to share something that is like, uh, what is the conclusion of? Okay, I'll do that towards the end. Let me just share my whole screen again. I hope you all can see the screen. So this is an app, care coordination. We are landing up to the demo part. Okay, before the demo somebody asked for the trial org. So you can always do this health cloud specialist super badge. Okay, you can always earn it. And this is a special developer org which has 30-day health cloud license. uh, if the license break off, you can always sign up to a new org. And now I am just putting in the link to the trial org wherein you all can sign up yourself for free. So here the demo part comes in. Here is my app care coordination. Again, I just made it while doing my super badge. So I'll just show you a patient Shankar Suman. If you would have done the super badge, or if you are going to do the super badge in future, you will be working around this patient Shankar Suman. And with this patient, we'll understand what we just saw as the things were a little small. We can always see them in the big view now, because this is in the real org now. Okay, those were just the screenshots just to explain you the concept. So first I want to see, this is a patient record. Why, when we work on Salesforce, we just try to understand a contact page, account page, lead page, right? So guys, this is a patient page. Okay, Shankar Suman, wherein we have a couple of details on the patient um, record detail page, the address, or maybe there are, this is all pre-built. I did not design this page with Health Cloud licenses. Couple of objects, templates, and features came in with those license already. Okay, so this is the patient card, wherein this is just the demographic information on the left hand side of the address, contact preferences, what are the medications going on, what is the condition. It is the patient is having type 2 diabetes, what is the insurance plan. It is attached with what is the member ID. Maybe we have some other integrations and stuff with which we want to fetch the member ID. Or maybe there is some member ID for particular providers. Providers are nothing but hospitals, right? There's something I just introduced a word payer as well. So payer can be a patient who is paying, or payer can be in the other role as well, in the terms of insurance company as well. Okay, so allergies, if any patient has some allergies, we can all not at all edit over here. Okay, this is just the demographic information, so as to understand the patient information, their demographic information. Okay, we were revolving around this particular timeline in our starting slides. So this what timeline is, what all events you want. You want all the open task, you want the closed task. This is just showing the start date as today. Maybe let's put something over here. Yes, for me, where's it has, just put maybe 1st April. No, 1st May should be fine. Okay, so what all task you want for a particular date, or how many days you want to show. I think this is good. How many days you want to show on this timeline, you can always configure it. This is not at all saved. This is just a filter. You apply, you see the information, you see a timeline over it. Okay, so exercise daily walk due date, it's like it's an open task that patient maybe did not complete the exercise. Schedule education, enrollment, self-care, these were the couple of tasks in dedicated with that particular patient. So even medical data or engagement data, what all categories you want, you can always configure it with the object name, timeline view configuration. Okay, even patient card information, uh, you can patient card, you can always go to patient card configuration and configure the fields that you want to see. Okay, so whatever fields, filters you want, maybe you want some additional filters, on what basis those filters should come. If I check campaigns, so what should be coming up. If I uncheck campaigns, what should be coming up. So that all can be configured with the uh, timeline view configuration object. Okay, this was the timeline. I'll just go back again to Shankar Suman. Okay, this is the patient navigation over the left hand side. The household. Okay, I want to show you the network that we were seeing, the internal and external network, wherein we can locate the internal family. Okay, this is coming like this. Maybe I'll show you in a different chart. Give me one moment. So again, this is the same thing actually. Just a moment. Uh, so this is again something with the patient that is called as care gaps. If there is any gap in the cares, maybe some diabetes medicine should be taken up and it's not being taken care of. The patient assessments, the household thing actually comes like that only. Maybe it is configured because of my super badge like this. Let me just check with the other patient. Give me 1 second. So in the related, I'll show you this one as well before we go to that the network. The health conditions, the clinical encounters, the patient immunizations, campaign members, diabetes coaching sessions, if there is any. So these are all the related things that can be attached. Any barriers, maybe there was a transport barrier because of which the patient could not get check-in of the health and a couple of things. Give me 1 moment. I think the view is changed, but this is the same thing. Okay, for which we see the configuration. Okay, so any questions so far before I land up to the uh, final conclusion, what all we learned today, what all we saw today. So these all can be, this is the console wherein the patients would be there. The care templates can be configured and attached to the particular patient for maybe diabetes care plan, for nutrition education. So these are the templates that we create at the admin level, and then it can be attached to the particular patients. Template for a particular care plan has goals, has tasks, right? What is the problem? To overcome that problem, what are the tasks? And with that task, what is the goal that we will achieve? Okay, so those are all related and have a relationship around it. So, any questions so far? Like SFDC, it is available for practice purpose. How patient can schedule his appointment? Okay, so how patient can schedule his appointment? Uh, I just shared a link, guys, for you all to get the trial org, how patient can schedule up an appointment. This is the just the record of the patient. Okay, so we need to register the hospitals are nothing but maybe get cloudy consulting. Okay, this may be the account, or you can register a couple of hospitals. I don't have the data of the hospitals in my org right now because this is not a full-fledged org over here. Okay, but you can always have the hospitals and patient can always schedule up an appointment. Okay, a little bit configuration you have to do. Okay, yes, development part is there in health cloud. Whenever you want some different uis, when you want customizations on your appointments, your schedules, maybe your data is integrated with other systems, right? Your patient data is coming from other systems. Okay, so yes, trigger to just upload your data, or to bulkify the appointments on the system. Okay, maybe there's another system who is capturing your appointments. Okay, and we are pushing it to Salesforce. So you can always we need to write a trigger for that, we need to write a bachelor's for that. And not every uh, hospital and a patient will have a standard functionality which is there in the health cloud. I'll give you a little bit brief on it, like how is health cloud collated and stuff, how we improve patient experience with health cloud. So you have couple of objects, and like with the help of licenses you have, well, you already have couple of accessibility over the system. Okay, it's just that you need to understand. And as I said, I'll just give you the link of the super badge as well, wherein with which you can have the whole detail, like from where, how do I create a patient, like I said, I'll show you, right, the uh, Shankar Suman patient, how can you create a patient, what is the data model of health cloud. Okay, so everything you can understand with the health cloud specialist super badge. Okay, so with this console that I was showing, there were just the three profiles: care coordinator, admin, system admin, and the health cloud admin. Okay, so these were a couple of things that I had. And I already discussed the care plan template, within which the hierarchy is like care plan template, within which there is a problem. For that problem there is a goal. To achieve that goal, the care plan template task comes under it. Okay, let's suppose there is a high blood sugar care plan template. First goal is to that related problem is uh, control the sugar levels, right? Because the blood sugar is high. So what are the tasks to control the sugar levels is the first thing, it's assigned to the care coordinator that hey, you have to care for this particular patient. Okay, we need to schedule couple of check-ins, maybe daily glucose self check-in and stuff. Okay, and also we can always add a goal as um, uh, the person does not know the diabetes self-care awareness, so we can always schedule the education enrollment sessions. Okay, and assign the patient to walk daily, exercise daily. Okay, exercise daily would be assigned to the patient and not to the care coordinator, because work has to be done by patient and not care coordinator. Okay, how we improve patient experience with health cloud. Okay, I just took that. Patient can see their information, or like community portal is available, either of the things. If you want the patient to see their information from the Salesforce itself, you can always give patient like a particular user or patient like things. But if you want to create it by a community site or maybe externally integrated system, you can always work around with that as well. Okay, so as I see no more questions on my end, I'll just move towards I just want to share one screen. Give me one moment. So I'm still waiting on the chat window if anybody has any questions, and then I'll give over the control to Payal um, for the rest of the event. Okay, it's sharing my entire screen. I hope you all can see my screen, the dark black screen with some. Pyle, can you please confirm because I cannot see my screen now?
Yes, Isha, it's visible.
Okay, so uh, by ending today's session, it's not just till here. Uh, it's like you'll have the recording on the same RSVP page. And also, you have the trial org link, you have the super badge to do and work more around Health Cloud from basic till the advanced, from to and fro end to end configuration you can always do over there. So, today's modern healthcare systems must rapidly evolve to meet the base expectations of connected patients, right? So, sales, I'll just write over here Salesforce, just avoid my spelling mistake. Okay, Salesforce Health Cloud puts the patient at the center of the care by giving caregivers core advantages, right? We see a complete view of the patient, right? As the first advantage, with integrated data from EHR, wearables, and more, make smarter care decisions by single control, right? And engage with patients across their caregiver networks or and on any device, right? So Salesforce Health Cloud developed in partnership with leading healthcare companies including Centura Health, DJO Global, Radboud University, Medical Center, UCSF, and Philips. Salesforce independent software vendors, ISVs, MuleSoft and Optum Systems Integrated SIs, Accenture, Deloitte, PwC, and Persistent support the solution by providing data and other technical integration solutions with leading medical IT systems such as Epic, Center, GE Healthcare, and others. Salesforce Health Cloud empowers you to go beyond health records and build meaningful relationships with patients. So, guys, I should be saying it towards the starting, but yes, this is uh, uh, not a marketing session. Just and please make your purchasing decisions on from the Salesforce executives or the Salesforce website only. Please don't make any of your buying decisions upon the presentation today. Okay, so uh, yeah, this is all for the day. This is just the conclusion, and I am going right back to the presentation and again checking if anybody has any doubts. Yes, anybody?
Isha, I see only one question which says, "What's the future of Health Cloud?"
Future. Tough question. But see, health doctors, patients are going nowhere, right? Uh, See, I just got cold right now because of the weather change. So, weather changes, we have some ifs and buts. So, something or the other will come in. There is no stop on health, right? So, future of health cloud is really bright, is the shortest answer I could give. Okay, so anything else, anybody? Thank you, John, for appreciating my session. I hope everybody enjoyed. Oh, yes. We may discuss more sessions, how it can be patient friendly, and how do we do more of practical hands on works in upcoming sessions. Stay tuned. And yes, I'll just drop in my Twitter ID, and you all can catch me over LinkedIn as well. These are the only two and see me, Trailblazer Isha. Yes, this is my Twitter ID. Okay, over to you, Payal. Thank you so much for inviting me here, giving me an opportunity to share my the cloud learnings. I hope everybody enjoyed. I would love to have small comments in the chat uh, of the feedback or maybe how you like the session.
Thank you so much, Isha, for sharing your knowledge over Health Cloud. And thank you so much, everybody, for joining us on the weekday. I hope you had a lot of learnings, and we'll be seeing all the learnings over Twitter. and we'll be announcing the winner of the session by tomorrow. Uh, you know all the hashtags and everything. I have posted in the chat. Once again, I'll be posting it. So yeah, thank you so much everybody for joining. And the YouTube, I'll be sharing quickly the YouTube link, or maybe you can find Father Puff Girls YouTube channel. All the recordings and everything will be available there. Thank you so much and have a great evening ahead.
Happy weekend. Bye.